Welcome to the Tom Stott Show. Thank you so much for joining us. We really appreciate the support. Today, we're super excited to have Jerry Swon from Retrieve Medical with us. He's revolutionizing the EMR system in the hospital management. They have been helping a bunch of hospitals in the East Coast, and they're expanding fast. So today, we're going to talk to the CEO, Jerry Swon of Retrieve Medical. Jerry, thank you so much. Welcome to the show. We're honored to have you here. Please tell us a little bit about Retrieve Medical.
All right. Well, thank you for the invite, Tom. And my background is investment banking. And over the years, I've been involved in several opportunities to commercialize technologies out of major universities, Cornell, Princeton, Rutgers, University of Louisville. And that's what made me aware of this technology out of the Stony Brook Medical Center in Long Island. So I went out to visit and saw revolutionary technology that we negotiated exclusivity as far as a license for the technology. And just to give you a little bit of background on the technology, here's what happens right now today. If you were to enter the emergency room at your local hospital, most likely they have all your medical records stored in what they call the EMR, okay? And it's probably a company called Cerner or Epic, most likely. So you have all your records stored there. Here's the problem. The problem is the doctors don't have the time to go into the medical records and research your history. So what happens is you are diagnosed by the physician based on what he observes, what you tell him, and any tests that he may run at the time. So in spite of the fact that all your history is right sitting in the medical records and he doesn't have access to them unless he wants to shut the door and take an hour and go do research, which they can't. They don't have the time to do that. So what does Retrieve do? Here we go. You register in the emergency room, and as you're registering, our software is doing what they say culling. We're going through all of your medical history. Now, this medical history is all guided and governed by CMS, which is Medicare, all their rules. So all of the conditions that you hear about with comorbidities, whether it's diabetes or blood pressure or whatever it is, okay, all have rules that CMS has determined are in and out of bounds, okay? So as we go through all your records, anything that is deemed to be irregular by Medicare, their rules, not our rules, okay, instantaneously is on the screen of the physician. So what that means is the physician now has another tool, probably the most important tool, your medical history, plus what you tell him, what he observes, and the tests he runs. So what happens is you get a better diagnosis, okay? You get a more thorough, complete diagnosis, and you get better patient outcomes because if you are admitted to the hospital, they address all of your problems, not just the one you came in with. And what happens in the hospital world, CMS, which is Medicare, who pays the reimbursement, okay, they say that if you're a more complex case, the hospital should get paid more. So what happens is as you do a better job as a physician, the hospital is going to make more money. Now, that's the way it was before. This year, there was a rule change. Before, the doctors were only helping the hospital to better take care of a patient and to increase revenue. All of a sudden, this same governing organization said, you know what? This is working so well for the hospitals. Mr. Physician, we are now going to require you to document better. You must have a more complex diagnosis. And if you don't, you're going to take a hit of 10 to 20% in your income. So now all of a sudden, the doctor who didn't have time to go into the medical records is now being told, if you don't go in those medical records, you are going to take a cut in pay. So guess what solves that problem? So not only are we helping the facility increase revenue, but now we are helping the doctor protect his income because Retrieve works for both sides. It makes the doctor document better, which gets him more money, and it makes the hospital receive more reimbursement because of the increased documentation.
Oh, wow. So this is incredible. So you are helping the hospitals and the doctors get more revenue. At the same time, you're helping the patient care by providing the EMR information in a more searchable, concise way. so that they can get the information before they see the patient. This sounds like such a important thing that they should have figured out. These Cerners and Epics, I think they should have already had something. But this is incredible that at the age of AI and all ChatGPT and all the searchable information. So this is so. For now, how many hospitals or which one are you working with that where you have implemented the system and you can see the result in real time?
So, Tom, that's a very good question. And in order for me to properly answer that question, I'm going to take you back to the history of the software. It was 2010, 13 years ago, when the head of the emergency department, Dr. Mark Henry, got very frustrated with what they call the CDI department. When a doctor makes a diagnosis, he hands it off to a CDI nurse. She tries to interpret his scribble and pass it on for reimbursement to coders, okay? So what happens is, because CDI nurses really don't understand what the doctor wrote, they spend all day long querying the doctor. What's this? What's that? Did you do this? Blah, blah, blah. So all of a sudden, Dr. Henry's team got very frustrated. And they said, we're done with this. We can't see patients and answer all these questions at the same time. Bring in the graduate school. So they did. Now, remember, this is 2010. So they brought the graduate school in and they said, here's what we need to do. And bottom line is, they were saying, we need to develop Retrieve. So in 2015, so we have 7 years of proof of concept here. 2015, they pushed the button, they implemented Retrieve Medical as we know it today. And immediately, all the profitability, all the quality scores of the hospital skyrocketed, generating 20, 30, $40 million a year of additional revenue. So it was a major, major breakthrough. Okay. However, let's understand something. Hospitals are not in the business of commercializing things. So they did this for themselves. And it was only because I had a friend tell me about it that I went to see them. And I brought my friend, Dr. Rosenberg, Dr. Mark Rosenberg. He was recently the president of the American College of Emergency Physicians. They have 40,000 members all over the country. He's one of the most recognized emergency physicians in the country, and a friend of mine. So I called him and I said, Mark, would you go out and vet this technology with me? He said, I'll do it. He got me so excited about the technology that we started negotiations with Stony Brook Medical Center to commercialize the technology. Now, that's when the journey began. Okay, and by the way, Dr. Rosenberg has evolved into the chairman of the board of Retrieve Medical, and he left his practice. He was running the third largest, busiest emergency room in the country, St. Joe's in Paterson, New Jersey, and he retired from there and came with me full time, which he is our chairman today. So the journey began in 2018, just early 18. What was the journey? The journey was, how do we commercialize this product? Well, what we learned was, unless the technology, the software was developed in the cloud, we didn't have a business. That took $500,000 in a year and a half, almost 2 years. So now we're in the cloud. And guess what? Now you have to get validated by these EMRs we talked about at the beginning of this presentation, where they store all the records, Cerner, Epic, Meditech. We had to go and negotiate with them for validation. So what they said was, guys, you built it in the cloud. That's great. Now, in a year and a half from now, we'll tell you whether you can go sell it to our customers. We have all the validation. It's done. Okay. We, in the meantime, while we were going through the validation process, we got 3 copyrights. We have 2 patents. We have 1 pending. So we started to build a fence around our technology, which is what we did. So we really just became capable of commercialization in the last 6 months. And during that period of time, I'm very excited to say we've already signed a contract with a major company that manages 70 emergency rooms in the Southwest. We implemented in their first one. We just got the second one. We're about to start with a major academic institution in Philadelphia with a partner who's a $4 billion company. We've signed agreements with Haney's, which is the New York State Association of all 197 hospitals. So we're very excited. We are working with a system out of Hawaii right now. it's the commercialization phase is underway, and I'm very pleased to say we're getting some very exciting results.
Oh, wow, that's crazy. Wow. So because I actually listened to Dr. Mark Rosenberg through a mutual friend of mine, Jason, told me about Mark Rosenberg, and I was so impressed that he's the chairman of Retrieve Medical, and I was like, wow, that's crazy. I'm sure he's in incredible demand with all the major companies, and so it's a huge asset for Retrieve. Now the thing is, what I'm thinking, you have a couple of patents, you have a couple of copyrights, but the area you are in, I don't see a whole lot of competition from startups coming in because you have it's been you have been developing it for so long. So the thing that I'm thinking right now is Cerner's and Epic, these guys. So I think when I think of it from their point of view, I think you guys would be a major acquisition target for these Cerner's and Epics. They'll be like, oh, we should have that already integrated in our system. Or so probably you don't have to just go through the hospitals. These Cerner's and Epics are probably going to absorb you within their system. Is that a possibility?
Certainly, it's a possibility, but we don't count on it. We can build this business without them, and until we build substantial revenue streams, they're never going to pay us what we're worth. So it's not anything that we really care about. We're an app, okay, and they have a business. They all have app stores, and they have a lot of apps, okay, and they all sound good. But guess what? Ours is, ours is an app with a real ROI, and those don't exist. But when you touch on competition, let me clarify exactly. It's really simple, okay? If you draw a line and you have Retrieve below the line and you have, I'm going to call it others above the line. Who are others? 3M, Microsoft. There's others sort of in the space that are trying to help doctors. But let's differentiate, because what I'm telling you is they don't compete with us, okay? They do not compete with us. If anything, we make them better. And I'm going to explain to you why. Remember, in the early stage of this presentation, I talked about the fact that we're more or less the research assistant for the doctor. We're doing his work for him. We're researching those medical records, and then we're saying, here's a good example. You know what an encyclopedia is. Let's call that the EMR. We're the cliff notes. So we give the doctor the cliff notes, okay, the history, so that he can make a better diagnosis. So now that's all below the line. That's before he makes his diagnosis. That's before he submits his diagnosis to the CDI team to review, okay? Well, these other technologies, they don't work below the line. They work above the line. So what they do is they're like editors, okay? You write a term paper, they're going to edit it, okay? Their technology starts to query the doctor. Did you do this? Did you do that? Based on words that they use in their diagnosis. So what they're doing is actually interrupting the workflow, and they're forcing the doctor to go back and go into the records and do all the things that Retrieve has allowed the doctor to not have to do. So the point is that if you had, I'm going to use an example, the 3M technology, okay, and you had Retrieve also, you would make 3M better because they would not query as much, because what would go into the diagnosis would be better quality. Almost like an accountant. An accountant always wants a good beginning balance, right? The better it is, the better his outcome is. And that's essentially what Retrieve is, and the difference between us and everybody else. Nobody else operates below the line, only us.
Wow, yeah, that's you touched on the competition side. No, I see a huge amount of potential, but at the same time, one of my concern is, all these major Silicon Valley VCs, or if they start pouring money into someone else, or my goal is to promote the startups that come here, and so hopefully they get the funds, and hopefully they get to be successful. Now the thing is, are you guys raising any fund, or are you guys self-sufficient right now, generating revenue?
So our revenues will begin in the next, actually this quarter, okay? As I said, we just began commercialization a few months ago. We just got all the validation. And as far as your venture funds, before they start pouring money, okay, into some other technology, first of all, we got patents, we got copyrights, and maybe bigger than both of those are the validation process. It doesn't matter how much money you have. It's going to take you 2 years to get through the system before you can even commercialize. So we're much more of a takeover candidate than we are about somebody else coming into the market.
Okay, so that makes a lot of sense. Now, the thing I'm thinking is, so you guys have been developing the technology through the graduate school, through the university system. You're working closely with the doctors. So right now, are you guys thinking of bringing in more tech folks, the engineers, to develop the product further, or you're looking for more doctors to coordinate with, and more hospitals, and the sales, marketing, and getting into the system, looking at the data? What's the main focus now?
So the main focus now is just revenue. We don't need more people. We outsource all our sales and marketing. We're set. We've got a tremendous infrastructure. With Dr. Rosenberg as our chairman, we have access to every healthcare system in the country. So all that we have to do, we're just call it blocking and tackling. Okay, that's it.
Wow. So right now, main goal is to get to the revenue. So now, I don't want to go too much, into the expectation, but in the 5 to 10 year range, where do you see in terms of revenue or profitability, or in terms of expansion? Any thought?
So with our pricing model, we get $25 per admission. Okay, and with that pricing model, if you want to use Stony Brook as an example, let's say now their revenues increased by 60 million. Let's say only 10 million of that was attributed to Retrieve. So they would pay us $500,000. They'd have a 20 to 1 return. Okay, so the ROIs are off the charts. If we have 250 to 300 hospitals, our revenues are over 60 million, and this is reoccurring revenue. So you have a company that would be worth, $600 million. So the point is, we're in what I call white space. There's nobody else doing what we're doing. Like I explained, below the line. Okay, so we think we own the space. We know we own the space. We're out talking to customers every single day, and nobody's saying to us ever, not one time, oh, well, we were going to think about you, but we're going to get 3M. Okay, so the point is that, as far as we're concerned, the sky's the limit, and that we've done really the hard work is behind us, not in front of us, and the fun is in front of us. Fun being selling our product and reaping the benefits.
Wow, that's incredible. I'm so honored to have you, and this is so much, because most of our startups we talk to mostly in the pre-seed, and they have the concept they're trying to figure out. But this is incredible that you have the model pretty much set, and it's just about to take off. We're honored that you came this time. After that, I don't think we're gonna get appointment with you. That would be hard. To wrap it up, in terms of future development, I see now you want to get into revenue, into more and more hospitals, things like that. Any of the other things you want to add on down the road, or you want to keep it pretty simple, recurring revenue, or you want to get into other sectors, like in terms of expansion-wise? I'm just thinking, any other plans?
So, Tom, we're shooting with a rifle. We understand where we are, how we got here, and what we have. And all we're going to do is just pursue this space because it's game changing. And the public markets are, very close to us. Okay, we have serious discussions, in those areas. And, we think Wall Street will treat us very well when they understand the story. And understanding it's not that easy. I gave you the example of draw a line, and you got, below the line and above the line. The people listening to this podcast, they probably get it more than, people that are in the business. But it is that simple. Okay, we're the scribe, we're the research assistant. And guess what? If you have a research assistant, you don't need an editor. Okay, and that's really the bottom line. And when we go see these hospitals, we're walking in as a startup, we're walking into major systems. And I'm a major, okay, I don't want to use the names here, but I'm talking about the biggest in the country. And they're not saying, oh, you guys are a startup. We're not hearing any of that. They respect what we have, and they know it's recognized. Documentation is the number one shortcoming in the hospital space. Number one. and we solve it.
Yeah, no, that makes sense. Your background as an investment banker, I think, is gonna probably propel you guys to go public down the road without, thinking of any other being an acquisition target. I think that may be something down the road.
No question. We've got the perfect team. Our CMO's been in the emergency space at the C level for 30 years. Our chairman, as we discussed, Dr. Mark Rosenberg, he's knows everybody in the business. And then a combination of that, plus my background in banking and having the ability to, entice and interact with Wall Street, we've got a perfect combination. We don't have doctors trying to figure out Wall Street. We don't have Wall Street trying to figure out technology or hospitals. So we complement each other, and we've been together from the beginning. A lot of our top people have worked for equity because they realize the value of equity is going to be tremendous. So we're just, very excited about what we've done to get here. And now, we're starting to bring everything to fruition.
This is my personal curiosity. Your background as an investment banker. Now you're leading this healthcare organization with healthcare documentation and with the doctors and the patients and the hospitals. So it's a little bit of change. What do you think about it? I'm trying to figure out what was the motivation from investment banking to helping the doctors.
So again, in my past, I've been very big in the oil industry. And from that, I brought a company public, and I was the CEO of a company that developed a keyboard for computers that works in a risk-neutral position. And that was back when repetitive stress injuries were a nightmare. Everybody's afraid of them, okay? And people working on computers too long were getting carpal tunnel syndrome and whatever. So we had a very successful venture there, which led me to the first solar pump that could be used in third world countries. And the stock, we brought them public and went to 150. That led me to a biotech opportunity that we developed, okay, that was helping AIDS patients, okay, that were dealing with mitochondria dysfunction and getting them to lead normal lives. And that was back in the mid 2000s, like 2005, 3, 4. And then that led me to Rutgers with a technology where we were taking brittle plastic forks and knives and had a recipe, okay, that with soft water bottles, okay, where you could take and put that together with that recipe and develop a material that was stronger than steel. We did it. We built bridges for the Army Corps of Engineers down at Fort Bragg. That company just got a $700 million order over in Europe for railroad ties. So the point is, I've been in a lot of different technologies. Different doesn't scare me away. I learn very quickly. I surround myself with very smart people that know the business and really engineer the result, which is what you heard about today on this podcast. Engineering, finding the opportunity, bringing the right people in, getting all the approvals, doing the blocking and tackling, sales and marketing and whatnot. And now we're all going to benefit. Our team is all going to benefit from what I call the strategic engineering that's been taking place.
Oh, thank you. Thank you for sharing that. One other thing I think it would be hugely beneficial for our listeners. Any words of advice you'd tell a young entrepreneur or a mid-aged entrepreneur, or advanced entrepreneur that starting out or just left the job from corporate world trying to get into the entrepreneurial world? Any words of advice for them?
Best advice is to know that there's a learning curve no matter what you think. And the way you get through the learning curve and succeed is surround yourself with smart people that know the space better than you do. That's what I would tell everybody. That definitely makes sense. Finding the subject matter experts in the field before just jumping in, I think that makes sense because Dr. Rosenberg in the board, having him as a chairman, and you have a lot of doctors in the company.
So I think Retrieve Medical is of a on a nice track. I think it's going to work out very well, and we're really honored to have you. We really appreciate it, and we would love to get to know the progress down the road. We'll keep in touch to see where Retrieve Medical is a couple years from now, and I'm really honored to have you.
Thanks for the opportunity to share the story.
Thank you. Thank you, folks. That's Jerry Swon from the Retrieve Medical. We're really honored to have him. Thank you very much. Please do subscribe. Thank you.